Hello and welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Joyelle Ray Alexander and I'll be your moderator today. Before we get started, I would like to ask that you please fill out your online evaluation at the end of the webcast. Continuing education credits are available after you take our short post test, and your feedback is helpful in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best serve your needs. As for today's program, we'll be taking your questions throughout the hour by phone. The toll-free number is 800-452-0662, or you may send your written questions by fax. The fax number is 518-426-0696. We will also be taking questions by email. Please email us at any time throughout the hour at phlive.newyork@gmail.com. We would like to thank our sponsors, including the Centers for Disease Control and Prevention's National Center on Birth Defects and Developmental Disabilities, the Association for Maternal and Child Health Programs, the University at Albany School of Public Health, and the New York State Department of Health Bureau of Early Intervention. Today's program, Learn the Signs, Act Early, the Importance of Developmental Screening. Our guests are Dr. Judith Lucas, a developmental pediatrician specializing in behavioral health at Albany Medical Center, and Dr. Donna M. Noyes, the Associate Director for Clinical Policy, Bureau of Early Intervention, New York State Department of Health. And thank you both for joining us today. It's a pleasure to have you here.
Thank you for having us.
Thank you for having us.
Dr. Lucas, let's start with you. This broadcast is about early intervention and the importance of developmental screening. Can you tell us about the typical milestones that are associated with developmental learning in young children?
Well, developmental milestones are a way for folks to track and follow the way their child learns about the world and acquires functional skills of childhood. Some of the signs, some of the developmental milestones are fairly obvious, such as physical growth, how big a child is, their height, their weight, their head circumference. Other milestones, the gross motor skills of crawling, walking, those are obvious. Fine motor skills, how a child learns to pick up small objects, those are obvious. When a child learns to speak, for instance, that's a fairly obvious sign. Some developmental milestones are less obvious.
Now, obviously, every child is going to develop at a slightly different pace, but can you review with us some of the milestones that you would expect at or around 15 months of age?
By 15 months of age, most children will make eye contact when an adult, when a caretaker talks to them. Most children by that age will reach their arms up in anticipation of being picked up. Most children have good shared attention, meaning that they will look to where their parent is looking, look at the object, and then refer back to the parent to show that they're interested as well. They call that three-point attention. By 15 months, that's usually well established. Most children by 15 months have a good deal of social imitation. They reflect body language, facial expressions. By 15 months, a child should consistently respond to their spoken name. So if you say the name, the child should fairly consistently turn. They will follow simple one-step commands, you know, bring me your shoes, bring me your socks, give me the toy. And by 15 months, most babies have at least a few spoken words. They should say mama and dada specifically for that parent. And on average, most 15-month-olds have a vocabulary of about 3 words.
Okay, and what milestones would you expect for a child developing, let's say, at or around 18 months of age versus 15 months?
Okay. By 18 months, the vocabulary generally has expanded to about 10 to 20 words, although there is a huge range in when kids learn to talk. On average, by 18 months, vocabulary is between 18 and 20 words. They should point to some body parts, so if you say, show me your nose, show me your eyes, they can do that. By 18 months, you should see the development of nice pretend play, social imitative play. So a child will pretend to feed a baby, pretend to feed a doll. Will pick up a phone and pretend to have a conversation. They'll do things that they've seen their family members, their siblings do. They should point out objects that they're interested in. A lot is known about the way children learn to point. In the first year of life, a child will point to something they want. They call that proto-imperative pointing, followed by proto-declarative pointing, meaning I see something, I'm interested in it, and I'm going to point to show it to you. By 18 months, that type of pointing should be fairly well established. And they should be able to follow a point. So if a parent says, look over here, they should follow that, and you should see their gaze diverted to that. If a child doesn't point to demonstrate interest, then a parent should be concerned. If they don't copy, they don't imitate others, that would be concerning. If they fail to gain new words, or if they have words and all of a sudden they are really gone, that would be concerning. Or if a child just seems to be disengaged, they don't notice when a parent comes into a room or leaves a room consistently, that would be concerning.
And finally, Dr. Lucas, can you tell us about milestones that we would see at or around 24 months of age?
By 24 months of age, the vocabulary generally has expanded to somewhere between 20 and 50 words. And a child will speak in brief phrases, 2 to 4 word phrases. They call that telegraphic speech. They should show interest in other children, and they should imitate what they see their parents do and what other children do. And again, you know, the pointing, they should be able to point to items in a book. If you say, you know, show me the picture of, you know, the horse, they should be able to fairly reliably to point to pictures in a book. If the child hasn't started to use words and phrases, if he or she doesn't know what to do with common household objects, or if he doesn't copy the actions or try to imitate the words of others, that would be concerning.
Now, you've identified some of the typical milestones that we should be looking for in young children as they develop, and you've identified some resources to keep track of that development. Let's talk now about what autism is.
Autism refers to a group of disorders characterized by impairments in social interactions, language, and behavior. There are a number of autism spectrum conditions. There's classic autism, or autistic disorder. There's Asperger's, and there's pervasive developmental disorder not otherwise specified.
Now, I know there's specific diagnostic criteria for autism. Can you tell us about the qualitative impairments in social interaction?
Certainly. There's 4 of each. Under the social impairments, we say there's an impairment in nonverbal behaviors, such as eye contact, engaging with, you know, posture, with movements, with gestures. There's a failure to develop peer relationships, and again, it has to be appropriate to the developmental level. Oftentimes, children on the spectrum appear that they seek out peers and others, but they don't keep those interactions going. They'll seek them out briefly and then tend to pull back. There's a lack of what we call spontaneous seeking to share enjoyment. We should see children, you know, constantly bringing their parents and their caretakers things that they're proud of, things that they're interested in, and children on the spectrum don't do that reliably. And then there's a lack of what we call social or emotional reciprocity. They often don't read emotions correctly, and they don't reflect emotional states all that well.
And what about impairments in communication?
Again, there's 4 things we look at. There can be absent or a significant delay in spoken language. There's an impairment in conversational language. They can't hold up their end of a conversation. Oftentimes this is tricky, and I think this is one thing that in the past a lot of doctors stumbled on. You know, these kids often answer questions. They interview beautifully, I say, but to have it be an open-ended question and then kind of, you know, expect a full sort of creative response doesn't always happen. So they have a hard time holding up their end of a conversation. They often have a stereotypic or repetitive use of language. One of the more frequent forms this takes is echolalia, where a child will repeat the end of a question as opposed to answering the question. They often repeat a certain rote phrase over and over and over again out of context. They often use scripted language where they repeat a phrase of a movie, a phrase of a video, a phrase from a book over and over and over. And again, the savvy kids can do this pretty well in context, but if you ask a parent, it's the same phrase over and over again. And then we see a lack of make-believe or social imitative play, and the things we talked about, feeding a doll or, organizing their play or organizing their toys to, act out something they've seen their parents do. That's really important.
Can you tell us about the behaviors, interests, activities that we might see in these children?
Sure. Again, there's 4 things to consider here. They have an encompassing preoccupation with a restricted interest. Oftentimes, the interest can be inappropriate to the developmental level of the child, but it becomes sort of a preoccupation. It's hard to tease out sometimes because most kids through their early childhood get something they kind of get stuck on or something they're really interested in. But the difference here is sort of the intensity of the preoccupation. Does all of their play and all of their conversation sort of circle back to this one thing? And can they shift away from that readily? They often are fixed to non-functional routines and rituals. Now, all kids have functional routines, so getting up in the morning, getting out of the house, getting ready for bed. But kids on the spectrum often have a host of routines that really don't have a lot of functional purpose. That's the difference there. They often have stereotypical or repetitive motor movements, such as rocking, flapping, doing things with their hands or fingers. And they have a preoccupation with the parts of objects. And the classic example here is instead of, rolling the car on the rug or, pretending to be the car, making car noises, they will sit and kind of spin the wheel of the car and kind of just study the facet or a part of an object, as opposed to playing with the object in a, creative, symbolic way.
Now, what does all of this diagnostic criteria mean? How do we know if the child will be diagnosed autistic or maybe given a related diagnosis as opposed to specifically being autistic?
Well, to make a diagnosis, a child needs to meet certain diagnostic criteria. If you have 6 of what I just mentioned out of the 12 criteria, if 6 are met, there's 2 social impairments, 1 language impairment, and 1 behavioral impairment at least, that child would be diagnosed with autistic disorder. If there's no language impairment, yet there is a social and a behavioral impairment, at least 2 social and 1 behavioral, that child would have Asperger's. And then if there's less than 6, or if the age of onset is over 3, or if there's what we call sub-threshold symptomatology, we would term that pervasive developmental disorder, not otherwise specified, or PDD-NOS.
Thank you, Dr. Lucas, for giving us such a clear explanation of how autism is diagnosed. Can you talk about the prevalence?
Certainly, and this is a topic I think on a lot of folks' minds, especially recently since the CDC announced that the current prevalence rate is 1 out of 88 children is diagnosed with an ASD by the age of 8, with 1 out of 54 boys being affected. These disorders are almost 5 times more likely to occur in boys. There's been a 23% increase since 2009 and a 78% increase since 2007. A lot of folks are wondering why that is. Why is the prevalence rate grown so dramatically in such a short amount of time? Certainly, we are now screening for these disorders. I think parents, caretakers, family members, teachers are much more aware of these disorders now, leading to increased recognition. Pediatricians are now screening for these disorders in their practices because we've come to realize that the sooner you intervene, the better the overall prognosis, not just for the child, but for the whole family. So it's important to find these kids early. Most children, however, aren't diagnosed until the age of 4, even though it's well recognized that early intervention helps.
Thank you for that information, Dr. Lucas. This seems like a good time to view a video produced by the CDC that reviews the Learn the Signs, Act Early campaign that has been developed to try to help create awareness about the topics we've been discussing.
In the U.S., nearly 17% of all children experience some form of developmental or behavioral disability. Recognizing a problem early for disabilities such as autism is key for parents and healthcare providers across the nation. To help children with potential problems reach a healthier future, CDC realized the impact of developmental disabilities and invested in a campaign known as Learn the Signs, Act Early. The program aims to help parents measure their child's progress in terms of milestones that monitor more than just the physical. Parents can gauge how their child develops by how they play, learn, speak, and act.
When a parent is worried that a child may have a developmental problem, there are a number of things they can do. They should talk to their child's doctor, contact the early intervention agency if their child is under the age of 3, or contact their local school district if their child is over the age of 3.
The good news is the earlier parents and providers recognize children that are delayed in reaching a milestone, the more intervention may help them to reach their full potential. All children develop at their own pace, and many reach particular milestones slightly late or early.
A parent may notice that a child is not acting like the other children in their playgroup.
What's a kitty say?
The child is speaking later than their brother spoke. This is a time when a parent should go to their child's doctor.
The age that a child takes a first step, smiles for the first time, and waves bye-bye offers important clues. A delay occurs when a child reaches a milestone at an age later than the average developmental rate.
Now show me with your finger.
By 8 months old, a majority of children turn their heads upon hearing their name, smile back when someone smiles, and enjoy playing games like peekaboo. 18-month-olds can engage in simple pretend play, point to an interesting object, or speak in single words without prompting. By their second birthday, many children speak in 2 to 4 word phrases.
It's Gina's turn. Where's the baby's nose?
Follow simple instructions and point to objects or pictures when named.
Keeping track of how she plays, learns, speaks, and acts is really important. Those are the things that you can do as a mom to learn those early signs of child development. Follow your gut, you're the expert in your baby, and you can make a difference by letting her doctor know if you're worried about something that's going on.
Cindy Gray noticed her daughter Catherine reached some milestones late.
Even though other people were telling me that Catherine was fine, it was just that she was premature and very small, I had a feeling it was something more than that.
Cindy Gray acted early.
Acting early and seeing the signs of that something wasn't right with her, and then taking those steps to find out what it was, even though that's really hard to do, made all the difference for her.
To detect a problem early, connect early with your child and observe how they play, learn, speak, and act.
We were so grateful that Catherine was diagnosed when she was, because it allowed us to immediately get her the help that she needed.
If you suspect a problem, act early. If your child's development seems to slow down or your child loses skills, seek a doctor's advice immediately. Most of the time, a developmental problem is not something children grow out of on their own, but with help, these children can reach their full potential.
Well, that was a very informative video and just one of the many resources provided by the CDC that we'll hear more about later on. Now, Dr. Lucas, you've certainly shared a lot of information with us that physicians as well as parents can use to become familiar with autism. What does the American Academy of Pediatrics recommend in terms of screening? You touched upon screening in the well baby visits, and can you delve into that a bit more for us now?
For years, the American Academy of Pediatrics recommended developmental surveillance at every well child visit, where parents were basically asked if they had concerns about anything about their child's development. A couple of years ago, the AAP began to recommend developmental screening at various intervals in childhood at 9, 18, and then somewhere between 24 and 30 months.
And what can you tell us about developmental surveillance?
Again, you know, that was what pediatricians really did for years, where you ask a series of questions about, you know, developmental milestones. How is the child doing in terms of his gross motor status? Was he walking, climbing, running, jumping, moving? We asked about language. We asked about any social concerns. But there was nothing really standardized or formal in the way that was conducted. And just surveillance alone was not an effective way to detect these types of problems.
And are there specific screening tools that are used to screen a child for, let's say, stages of development?
There's an extensive list available in the Journal of Pediatrics. Two of the most commonly used screens are what we call the ASQ, the Ages and Stages questionnaire. I like that questionnaire. It's free. You can download it. It's very easy to use in the context of an office visit. It's very easy to score up. And it's also nice because it kind of serves as a parent educational tool. Here's what we think your child should be doing. So I like that. It has very good sensitivity and specificity as a screening instrument. The PEDS, the Parents Evaluation of Developmental Status screen, is also very good. There are now CPT codes devoted to developmental screening where this aspect of pediatric care can be reimbursed to defray some of the costs associated with these tests.
Now, are there autism-specific screening tools?
Yes, the American Academy of Pediatrics recommends a specific autism screen be conducted at 18 months and then again somewhere between 24 and 30 months. The one I think most folks are familiar with is called the MCHAT, or the Modified Checklist of Autism in Toddlers. If the child screens positive, then a follow-up interview is conducted, and again, that's free. You can download that. It's very easy to administer and then score up. There's also the Infant and Toddler Checklist. Again, that's free to download. And again, the CPT, the screening code applies to this as well.
With the incidence increasing so much recently, I would expect that professionals have come up with a list of red flags or signs that would cause concerns for parents as well as physicians. What can you tell us about potential red flags?
Certainly. If a child has a delay in spoken language or has, you know, what we call an attrition of language, if, you know, the language is developing well, you know, till about 15 or 18 months, and then the child seems to lose language, that would be concerning. Again, a loss of words that were previously used fairly frequently, that would be alarming. If a child seems to lack nonverbal communication, doesn't have gestures, doesn't reciprocate, doesn't look you in the eye, doesn't gaze monitor, that would be concerning. If the child seems to look through people, or parents often tell me it's like he's looking at me, but he's not. He's looking around me. He'll do everything to avoid looking at me, or I have to socially coach him a lot. I have to say constantly, look at me, look at my eyes. That would be concerning. If a child doesn't take turns or doesn't imitate, that would be a concern. If the child doesn't do that proto-declarative pointing we talked about, if he doesn't look at things and point to demonstrate his interest, if the child doesn't have good joint attention, If he doesn't look at things, doesn't engage with a parent, that would be a concern. Or if the child has an unusual or repetitive movement, again, we talked about rocking, flapping, that would be a concern.
And it could certainly be one of the red flags or multiple components of the red, that would be red flags. Now let's talk about what you would say to a physician who has some concerns about his or her patient's development.
Again, part of the challenge of doing this as a pediatrician is, we have a finite amount of time in a well child visit, and there's a lot of ground to cover these days. If there is a concern, by all means, schedule a follow-up visit to really just spend a nice block of time really solely focused on these concerns and on the child's development. You can certainly refer for an evaluation either with a developmental pediatrician, a neurologist, or a psychologist, and then you could always refer to the local early intervention program or the local school district.
And what would you say to a parent who have concerns about how their child is developing?
I think the first call should be to their primary care provider. Hopefully this is an individual who knows the family, who understands the family and knows the child well, and should be able to pick up on these concerns as well. The family can certainly contact early intervention or their school district if the child is over the age of 3. And then can reach out to other parents who are facing the same challenges. Parent to Parent of New York State is an excellent group, and then they can contact their local early childhood education center.
Now, we know that sometimes parents express their concerns about how their child is developing, and they're told, wait and see, wait and see. What can you tell us about that?
I think for a lot of years, that was sort of what pediatricians do. We'll watch, we'll follow, we'll keep track. And now that we know so much more about the importance of early intervention and getting these kids identified, getting services in place sooner rather than later, I think a lot of pediatricians and primary care docs have moved forward in getting these kids looked at sooner. So we've kind of taken a step away from wait and see to, well, let's chase this down and let's see what's really going on. If a parent comes in at 18 months expressing concerns and they take the wait and see approach for whatever reason, boys talk later than girls, all these things that we used to kind of believe, that can really slow things up. If the child then wastes 6 months waiting and seeing, they can lose some valuable time. Oftentimes these kids weren't picked up till preschool, the age of 3, 4, even as late as kindergarten. And obviously that's valuable time lost.
Thank you so much for that information, Dr. Lucas. It seems like the message that you're articulating today to both physicians as well as parents is that if there's a concern, action should be taken.
Absolutely. If a parent's concerned, talk to your doctor, get an evaluation done, and don't be afraid to act on it.
Thank you so much. With that in mind, I think this is a great time to hear from a mother about her experiences as a parent of an autistic child and the role of early intervention.
Hi, I'm Luann Wade, and I reside in Albany, New York, with my husband Dennis and 2 children, Jonathan, who's 9 years old, and Caitlin, who is 7 years old. I suspected Jonathan had autism very early on. Even as an infant, he didn't act like a typical child. He took bottle after bottle after bottle. He was never satisfied. He was a very, very fussy baby. And then I began to become really concerned about 12 months of age, and that's when I contacted my pediatrician. My initial response that the pediatricians had given me was they didn't think that Jonathan fit the profile of an autistic child. Again, he had recognized that Jonathan was social, he had the social smile, he seemed to be connected, but he wasn't listening to the other concerns that I had. And I made numerous calls, 5 or 6 calls, frantic, crying, and said, no, I really think that something's wrong developmentally here. By the time Jonathan had received services from early intervention, it was 6 months later than when I first brought my concerns to his pediatrician. He lost 6 months of intensive services because his pediatrician did not listen to my concerns. I would definitely tell other parents that have concerns about their child's development not to stop, to really try to pursue. If they feel that something is wrong with their child, they usually are right. My daughter Caitlin is 7 years old. At 12 months, I asked my service coordinator to have somebody come out and evaluate her. I knew something wasn't right. And early intervention came out and said, you know, we're not ready to give her services yet. Let's wait a little bit. I said, no, let's have somebody else come out and get a second opinion. That second opinion proved helpful because they shared my concerns with her as well. We as parents of autistic children have different stressors than typical parents. I would just love for an office staff to just be a little more sympathetic of our needs. Waiting an hour and a half in a waiting room is just not good for a child on the autistic spectrum. Not good for any child, but you know, typical peers can handle things a little bit better than children on the autistic spectrum. They typically cannot wait. So if they could just come up with some strategies to help the parent out a little bit and to not make us wait so long in the waiting room, or just to understand what we're going through, would be really helpful.
What an incredibly powerful video. It's really great to hear from the parents' perspective of what their needs are and what their experience is like. It's just tremendous. And now, Dr. Lucas, you know, you've given us extremely valuable information regarding the importance of developmental screening and early intervention. Dr. Noyes, we'd love to hear from you now. Perhaps you can talk to us about what New York State is doing to promote early developmental screening and autism screening.
I'd be happy to. First, I'd like to tell you a little bit about the early intervention program in New York State. Early intervention is under the Federal Individuals with Disabilities Education Act, Part C of that act. In our state, the service system has been in place now for 19 years, going on 20. And we serve about 70,000 young children and their families every year with a whole variety of therapeutic and supportive services that is really designed, a program designed in conjunction with the family. So it's a family-centered service delivery system, and families play a really important role in early intervention.
Dr. Noyes, what can you tell us about the different grants that the department has received?
We have several grants right now specifically related to autism. 2 of them are funded by the Health Resources and Services Administration. Those are under the Combating Autism Act funding at the federal level. One is a state implementation grant that's designed to help us implement a plan to improve services for children and youth with autism spectrum disorders. And a second one is from the Maternal and Child Health Autism Research Program. We're looking to evaluate the impact of early intervention services in New York State on children and families with autism spectrum disorders. And then we have 2 grants from a private foundation out of New York City that really provides funding to support children, families, and communities in need. One of them will expand our efforts to train physicians in early identification and interventions related to autism, and the second will help us update clinical practice guidelines that New York State issued in 1999. We were the first state actually to issue clinical practice guidelines related to the assessment and treatment of young children with autism.
Now, what are the key goals of the state implementation grant?
Our key goals are really to promote the AAP guidelines for universal screening for autism spectrum disorders that Dr. Lucas was describing for us earlier. We also want to make sure that we're engaging and supporting pediatricians and family physicians not only to screen but also to refer children to early intervention services, and then once they actually have a family engaged in early intervention, to stay involved in those services.
And what can you tell us about training for physicians?
We have designed a program for physicians that is really a 2-part evening training session. It provides CME credits for physicians. And the first part is on early identification and screening. So we describe how to incorporate universal screening for ASDs and other developmental concerns into MD's practices. We have a developmental pediatrician practicing who does that for us. We also describe developmental screening and surveillance and how important that is. We educate physicians on early signs of autism spectrum disorders, and then we introduce them to resources that are available to help them assist families in their practice and to help them assist their practice in screening for autism spectrum disorders, as well as other developmental concerns.
And I understand there are some online resources as well.
Yes, we have developed in our state a portal for physicians that is housed on our Department of Health Commerce system. That DOH Health Commerce system is a secure network, and physicians access that routinely for a whole variety of functions. We have a portal now that's specifically designed to help physicians learn about autism spectrum disorders and the resources available for autism spectrum disorders.
Well, before we delve more into the online resource, I'd like to go back to the physician training and support. And I want, if you can give us a little bit more information about the two-part evening training and what's entailed in that.
Sure, sure. So we talked about the first part of that training really being focused on early identification and screening. The second evening is focused on how to communicate with families once you've made a diagnosis of autism, and we have families participate in that session with us. We also talk with physicians about what the best interventions are for young children with autism spectrum disorders, and again, the importance of staying involved in early intervention. And we also talk with them, and Dr. Lucas has done much of this training for us, we also talk with them about the medical needs of children who have autism spectrum disorders.
Now, back to the online resources. Okay. When the physicians go onto into that portal, what do they see when they go into that first page?
The very first page is a welcome page for them. It features a navigation bar that tells them about all of the resources that are available through the portal.
And what resources are in that portal?
And lots of resources for physicians. We have designed the portal so that there are links to many pages that describe what's available in New York State, what some of the most current information is about autism spectrum disorders, where they can find local resources in their community.
And so the physicians would also be able to locate information regarding additional resources through that portal?
Absolutely. For example, if they have a concern about a child in their practice, they can go right to that portal and find local resources, how to refer the child to early intervention, what parent supports might be available, really many resources that would help them support the family.
What about if a physician needs to refer a child for early intervention services?
The portal will direct them to the county that so let me step back for a minute and say that in New York State, early intervention is administered locally by New York City and the 57 counties, most often in county health departments. And so the portal will direct them to the county department responsible for early intervention and give them really explicit instructions on how to make that referral for a family.
And what if a physician wants to ask a question via the portal? Is there an opportunity to do that? Is there utility available?
There absolutely is. In fact, we are collaborating with our University Centers for Excellence in Disabilities. We're fortunate to have 3 of those in New York State. And we have experts, psychologists and developmental pediatricians who are available to answer questions for physicians that they might have about autism spectrum disorders or also other developmental concerns.
Those are just excellent resources that are available online for physicians. Are there other training tools that the department provides as well? Or are you conducting other training offerings for physicians?
We are. In addition to that 2-part series that I mentioned, we've also been working with the American Academy of Pediatrics and the Academy of Family Physicians to try to incorporate our training activities into their meetings with physicians. So our staff and our trainers have gone to statewide meetings where physicians have gathered, for example, to learn about immunizations for children, and we've incorporated training into those forums for physicians. That's been a really great way to reach physicians. We also are currently working with the Academy of Family Physicians to do a series of grand rounds in hospital settings based on the CDC autism case training. And so we've really made an effort to try to reach physicians where they are with this important information.
That's terrific. And Dr. Noyes, what resources are available through New York State's early intervention program? If you can take us through that, that would be helpful.
Sure. We have a whole variety of resources available. Again, as I mentioned earlier, the services for families are at no cost to families. And so there are a whole range of services for families available. We have a wonderful homepage on the Department of Health homepage for the early intervention program, and that includes information about the program itself, information about our parent guide for families. We have our clinical practice guidelines posted. Anything you want to know about the early intervention program can be found on that website.
And are there other websites where viewers can find information as well?
There are. There's actually an interagency website that has been sponsored by our Office of Persons with Developmental Disabilities. It's called New York Acts. Very wonderful resource for families, for professionals. The Office of Persons with Developmental Disabilities provides a whole range of services for individuals with developmental disabilities, including individuals on the autism spectrum. They have a great website. Our state education department provides a whole host of educational services for children with autism spectrum disorders and other developmental concerns. They have lots of information on their website. And finally, we want to highlight the healthytransitionnewyork.org website. That's specifically for individuals, young youth who are in the 24 to 25 age range and are transitioning from childhood services into adult services.
Terrific. And in addition to the resources available through New York State, can you tell us the resources that are available through CDC?
CDC has just a wealth of information on their website around early childhood development. We have really taken full advantage of the Learn the Signs, Act Early materials. There are brochures, there are posters, booklets. All of these are free. They can be ordered online, and they're really wonderful resources.
And does the CDC have resources, you know, that go more specifically into Act Early, and tell us a little bit more about that?
They do. They have, again, a whole host of resources, both for early childhood professionals, physicians, and for families that provide really good information about child development, how to monitor child development, what you should be looking for, what you should know. Really all of the things that Dr. Lucas was mentioning earlier are very well explained and accessible to folks on the CDC website.
Well, this has been such great information, and what's even better is that you've provided contact information where viewers can obtain more information if they'd like. So we greatly appreciate that, and we do have questions that have already come in that we'd like to get to you right away. Dr. Judith, first, Dr. Lucas, first question is for you. If there's a concern of autism on a screening test, what's the next step?
Certainly, I think the first step would be to schedule a follow-up visit with the child's pediatrician so that the concern can probably be fleshed out by someone who knows the child well. The next step after that, if there is in fact a positive screen, would be a referral to either a developmental pediatrician, a neurologist, or a psychologist. Again, often there can be a lengthy wait to get to see one of these professionals, so the next call should probably also be to an early intervention agency if the child's under 3, or to the local school district if the child's over the age of 3.
Okay, so when you say a lengthy wait, are we talking months?
It can be months.
It could be
right.
months.
So now the recommendation is, you know, don't wait until a diagnosis is formally applied. Get services in place assuming that there's an issue, assuming that there's an issue. Contact early intervention, get services in place, and see what the diagnosis is after that.
Thank you. And Dr. Noyes, here's a question that's come in for you. If parents have a concern and think that their child needs early intervention, how do they get a referral?
Well, there are a couple of ways that that can happen. Again, we also would really recommend that families contact their primary care physicians first and have that initial conversation about their concerns. The physician can assist the family in making that referral, or a family can directly refer their child to the early intervention program if they have concerns. So if they're feeling like they need to reach out directly to the program, they certainly can do that and make the referral directly.
Thank you. And I'll direct this next question to you, Dr. Lucas. If my doctor says, wait and see, we discussed this earlier in the program, but the parent's concerned, what should I do to get a second opinion? Is a second opinion, is that something that's routine? If the doctor, in fact, says, wait and see, everything appears to be fine to me, the child doesn't, isn't staring off, don't worry about it, calm down, you're a first-time parent. These are the type of things that a parent may hear. Can that parent call for early intervention?
Absolutely. I think there's certainly no harm in getting another opinion. So whereas years ago we would kind of take more of a, not a laid back approach, but we would kind of wait and see and, give it a couple of months. I think now most folks are more proactive.
Okay, thank you. Now, you mentioned earlier that there are support groups for parents. Please repeat the names of those support groups, because some of our viewers are wondering about the names of those, or how they can gain information to the support groups.
Yeah, Parent to Parent of New York State is really a wonderful resource for families in New York. So and I think that we actually had provided earlier information about Parent to Parent. I think that's a great place for families to start.
Thank you. Let's see if we can go through some of these questions here. Here's one for you, Dr. Lucas. Are there any special medical needs or concerns for children with autism?
Certainly. I think it's important to recognize that it may be hard to address a medical concern in a child with developmental delays and/or autism in the span of a brief, 15-minute office visit. So I think it's important for clinicians to give these patients and these families extra time if it's at all possible. Kids on the spectrum do face a higher risk for certain medical disorders and medical conditions. Among those, children on the spectrum have a fairly high incidence of GI-related issues, with reflux, constipation, diarrhea, abdominal complaints, and especially if a child is nonverbal, these complaints can be very hard to tease out. Oftentimes, the way these issues manifest is with behavioral changes, irritability and aggression. So GI complaints, they estimate, can be seen in upwards of 75% of kids on the spectrum. Very common. Other conditions, sleep disturbance is very, very common. Again, anywhere between 50% and to 3/4 of kids on the spectrum experience significant sleep disturbance. Sleep plays a very important role in development and in behavior, especially with unwanted behaviors, irritability and aggression. Very important to make sure you know what's going on with the child's sleep. These kids are at higher risk for sleep disorders. Other concerns, seizures are also much more common in children on the spectrum, other neurologic conditions. So certainly these kids do have other medical issues.
Thank you. Here's a question that perhaps either one of you can address. if someone's received a script from their NP with a diagnosis of provisional autism spectrum, what does this mean, and what advice should this physician give their parents?
Probably the best advice there would be to get services in place, to have an evaluation through EI or through the school district, get services in place, again, while you're waiting to get the diagnosis confirmed by a psychologist, a developmental pediatrician, or a neurologist.
Thank you. How can medical folks attend trainings? Where are they held?
Oh, that's a great question. Right now, we are planning some training sessions for the Long Island area of New York. And I think the best way for them to learn more about when those training sessions will be happening, if they're in that area of the state, would be to contact our office. And we've already provided information about how to reach us. So I would say contact us. We are also posting information about our training sessions on the physician portal. So it's a great place for them to check about what training sessions are upcoming and how they can access them.
And are resources available to providers and parents in the state of Pennsylvania? Do I have access to the New York State Department of Health portal if, in fact, this person is in Pennsylvania? If not, are there national resources that are similar to the New York State Department of Health portal?
That's a great question. The New York State Department of Health portal really is designed for physicians, and only physicians have access to that. It's a special resource for them. Our public website is available to anyone, but I also know that the state of Pennsylvania has a very active early intervention program, and there are some wonderful websites nationally that can help families and providers learn about early intervention services in their state. Probably the best place to go is an organization called NECTAC, NECTAC.org. We'll get families and professionals to that website. It's a national technical assistance center funded by the U.S. Department of Education that really provides support both to states and all folks involved in early intervention services, and that has information about every program in the United States.
Okay, 2 quick questions to get to before we close out the program. Can you comment on people first language, a child with autism rather than an autistic child?
I think that's an excellent point. Certainly, there's no 2 children with autism who are alike. You know, the running mantra is, if you've met one child with autism, you've met one child with autism. These probably represent a polymorphous group of disorders. And, you know, just like no 2 children are alike, there's certainly no 2 children with autism who are alike. And I think it's very important to remember that first and foremost, they're children. They're children with issues, but first and foremost, they're children. So that point is extremely well taken.
Thank you. And for the parent who suspects that their child may be on the autism spectrum, but perhaps have missed an early diagnosis, and they're now in their teen years, is there support or help for that parent who suspects that, you know, their child may be along this spectrum but did not receive any of the early diagnosis or any of the early intervention and did not have access to those resources, and now they're in their teen years?
There are services available, certainly. I think we would also, again, say that physicians are important in helping families find resources, even when their child is in their teens. Actually, many of the physicians who attend our training have specifically asked that question of us too, what resources are available for older teens. In our state, the state education department, again, school districts provide a lot of services for children and youth with autism spectrum disorders. The Office of Persons with Developmental Disabilities is a very good resource, and there are regional developmental disability services offices across the state. And another great resource is the Developmental Disabilities Planning Council. They have lots of information.
Thank you very much. Thank you so much for being here today and providing this timely information, comprehensive information. You've done just a tremendous job and continue to do tremendous work both in New York State, and we greatly appreciate you being here and helping parents and physicians. Thank you so much.
Thank you for having us.
Thank you.
Thank you for joining us. Please remember to fill out your evaluations online. Your feedback is always helpful to the development of our programs, and continuing education credits are available. To obtain Nurse Continuing Education Hours, CME, and CHES credits, learners must visit www.phlive.org and complete an evaluation and the post-test for today's offering. An archive of this webcast will be on our website within 2 weeks. Please join us on May 17th for the next broadcast of Public Health Live, when our topic will be HIV testing update, new regulations and strategies from the field. I'm Joy L. Ray Alexander. Thanks for joining us on Public Health Live. Thank you so much, Dr. Lucas.
Thank you.
Thank you, Dr. Lucas. This is terrific.